my name is Robert Chang. I'm a nephrologist with a background in transplantation, and I'm with Nephrology Associates Medical Group. Oftentimes I see patients and they will ask me what transplantation is, and oftentimes preceding that we come about this discussion because their kidney function is declining or not very good. So the beauty of transplantation is, I would say they're medical miracles. A transplant is basically when a patient receives an organ, and we're talking about kidney transplants for my patients, and that transplant will allow a patient to have a kidney that functions normally. It is different from dialysis in the sense that there are no more machines needed to sustain that patient. The one thing is that transplant patients will need to be on medications to prevent rejection. And now rejection is oftentimes a scary word for many patients. I think one way of looking at it is basically the immune system is overactive and attacks the transplant, and it causes inflammation. So to prevent rejection, any transplant recipient often is on lifelong immunosuppression. Quality of life for transplant is probably, for transplant patients, is probably the main driving factor for receiving a transplant. Transplant patients can pretty much do anything that everyone else can do. The one caveat is no contact, or being careful with contact sports. There have been basketball players in the NBA that have received transplants. There are professional athletes in other arenas that have received transplants. So it definitely allows someone to live their life to the fullest.